Hello. Today we are talking about scoliosis and pregnancy. And today we're here with Dr. Meghan Teed. She's a physical therapist who treats people all over the world who have scoliosis. Her practice is called Mindful Movement, and you can find her on Instagram at the Scoliosis Therapist. Hi, Meghan. How are you doing?
I'm doing well, Mary. Thanks for having me on. I'm excited to be here
Yeah.
and talk about all things scoliosis and pregnancy.
Yeah. Yeah. I think when you and I met earlier this year in our program that we're in a coaching program together, I've learned so much about scoliosis from you. And even though I'm in the industry, it's crazy that I really didn't even know the extent of all the additional treatments that can be done for scoliosis.
Yeah.
So I'm excited to jump in today and get to it. All righty. Okay, so we have a question from Tasha. She's a 36-year-old from Northern Virginia. And she writes, Dr. Mary, I've had scoliosis my whole life and have been fearful of getting pregnant because of it. What can I do to prepare prepare my body for pregnancy, or is it off the table? So, what
Mm.
do you think?
This is such a common question for people that have scoliosis. A lot of people have been told by their doctors that it's not possible for them to get pregnant, somehow magically affects your fertility rates. Having scoliosis, which is totally untrue. It is, I know, probably 80% of my patients are mothers who have gone through pregnancy, delivery, and had lots of success without any hiccups. So that's even kind of baseline without having treatment for their scoliosis. That's before they even get to me. With that said, there are ways to make it a little bit easier if you do get pregnant and you have scoliosis and you have access to somebody that understands your scoliosis. I'm forgetting the second part of the question.
Yeah, what we're gonna do is we're gonna just go ahead and dive in. So, what are
Mhm.
some myths? Scoliosis is your realm, right? And
Yeah.
so, what are some myths that you hear a lot about scoliosis and pregnancy with your patients? Because I know that you've mentioned to me, this is a very sensitive subject for people with scoliosis because there's a lot of fear around it. And even just being in the medical community, most people don't know what to do with scoliosis. They say, okay, either brace, scoliosis,
Mhm.
or spinal fusion. And obviously, that's not realistic for a lot of people and
Yeah.
may be pretty extreme. So, talk to me about some myths that you've heard in pregnancy.
Sure. Yeah. The question that you just asked me from our Northern Virginian, that is a very common myth that like they can't even get pregnant with scoliosis. Some of the other ones, scoliosis is caused by carrying or lifting heavy weights while you're pregnant. Pain and discomfort associated with scoliosis will definitely increase if somebody becomes pregnant. That's another myth. Those two, they're definitely untrue. It's highly recommended that you actually lift weight if you have scoliosis while you're pregnant. It's even better if you're doing that beforehand and preparing your body for what's to come and getting as strong as possible. But it's
Hmm.
definitely untrue that lifting heavy things causes you to get scoliosis. It is possible that your scoliosis could progress during pregnancy, after pregnancy, if you're not doing anything to counter it, and then you have all of that relaxin in your body and you're doing all these new activities like carrying a car seat, carrying your baby. Those are things that can actually cause the curve to progress if you're not doing anything to prevent that and be proactive about it. Uh,
Yeah, it's really it. Oh, sorry, go ahead.
no, go ahead.
Oh, okay. I was just gonna say, I think even in people without scoliosis, kind of that functional training of doing those activities is really important. And a lot of movements after birth and caring for children are a lot of one sided, awkward movements, right? So, holding a baby on one side and doing activities with the other, like you said, carrying a baby car seat, all of those things can add up, and it's not uncommon for me to see people with back pain that haven't built up a baseline of strength
Yes.
prior to pregnancy. And then because of that, we're having to train those muscles. Any strength training is gonna be great, but specific those working on those specific movements can sometimes give you an advantage
Mhm.
to reducing injury, and then, like you're saying, potentially reduce the risk of the curvature increasing, which it sounds like that's a big fear for a lot of people with scoliosis.
Yeah, yeah. So, like, just baseline without even considering pregnancy or any other life circumstances, if your curve is greater than 30 degrees, on
Mhm.
average, your curve will increase without if you're not doing anything preventatively. On average,
Mhm.
your curve is going to increase about a degree per year. If you're thinking this person is diagnosed when they're 15 years old and
Mhm.
their curve is around 30 degrees, you just have to calculate what does that mean for you in your future.
Yeah. That sounds really scary. That sounds
It is.
scary,
Yeah.
and I could see how a 15-year-old, or maybe the 15-year-old even isn't even processing it, but especially, like, the parents hearing that, and what I think is scarier about it is, like I said, this is almost a topic it's just accepted in healthcare, at least in the States, where it's just, "Okay, like, just watch it." What does watch it look like?
Yeah. We're
I'm
definitely
gonna stare in the mirror and just
Yeah, we're definitely a neglected population. I don't even think that we mentioned that I have scoliosis, so this is like a very personal topic to
yeah.
me because I've experienced all these things growing up, just being told, "Oh, your scoliosis isn't bad enough to do anything about it, so we'll just watch and wait and see if it gets worse." What
Yeah.
kind of man is this?
It's crazy though to me because we have two main kind of groups of stabilizers, right? We have our passive stabilizers of the spine and then our active. So we've got our passive stabilizers, which are like our ligaments that connect bone to bone. And then you've got your discs
Mhm.
and you've got just the bone alignment of the spine. And then you've got your active stabilizers, which are your muscles.
Yeah.
And so, how are we completely forgetting about all of these muscles that can help us
Mhm.
when we look at it in a different way in every other part of the body? I
Yeah.
almost feel if you have scoliosis and a pelvic floor dysfunction, it's in this current healthcare system, you're probably shit out of luck.
Yeah.
And so, unless you find the right providers, because there's so much you can do for both, but mainstream kind of medicine doesn't necessarily there's not like a typical plan.
No, you have to fight for it. Like, you have to be your own biggest advocate in both aspects with pelvic floor and with scoliosis. It's like you're on your own. So,
Yeah. Some of the stuff that you offer, so Schroth Physical Therapy. So if obviously they can follow you on Instagram and look at a lot of your before and afters. I think those are awesome so people can see, hey, there is hope. And so what would you say? So say if somebody obviously they can follow you and you have some group coaching, but would you say that if they wanted an in-person session
yeah.
and they weren't in South Carolina near you, would they look for a Schroth physical therapist?
Yeah, I would say looking up Schroth Therapy or Pilates
Mhm.
for scoliosis, looking up other specialists in your area that you could have access to. Schroth Therapy is the gold standard in the physical therapy realm for
Mhm.
treating scoliosis. So if you have access to that and can be consistent with it, it's life changing to be able to get involved in that. Yeah.
I've seen some of the stuff you do and my mind is just it's just blown and I love it. So before we dive into how she can prepare for pregnancy, can you give us like a few minute blip of, what you do? Because I think a lot of people are probably listening and they're like, what does this even mean? So if you could give us an idea of what scoliosis therapy is.
Sure.
So that,
Yeah.
yeah.
Yeah. Scoliosis therapy, whenever I start with a client, my main goal is to educate you as much as possible about you and your curve and what your
Hmm.
tendencies are. So we go through a whole assessment process similar to your traditional physical therapy, but we're taking measurements that are specific to your scoliosis. So we're measuring the circumference of your ribs at different points and seeing what your rib expansion is like in different areas of your rib cage. We're also measuring your height because it's possible to improve your height with scoliosis therapy, which is pretty sweet. And then we also will assess like your baseline posture. People that have scoliosis, they tend to really not want to look at their back or have anything to do with seeing their
Mm.
appearance. It's something that can be really stressful and cause a lot of anxiety. That part can be difficult in the assessment process, like actually looking at your back on a screen and just taking in what your baseline is. So we're not trying to diagnose or pinpoint something. We're not judging it. It's just this is where you're at. This is your
Mm.
baseline. And in that aspect, you're able to acknowledge and have awareness of what your tendencies are so that you can begin to make some changes to that. Um,
Yeah.
yeah, that's really powerful for people to see it and then also see that they're able to come out of their curve just making really simple adjustments in the way that they're holding their weight in their feet or with their hips, just shifting them right or left depending on their curve type. It's not really major things that need to be shifted and changed. It's just these little micro adjustments that can make a huge change overall. So
Yeah, I know that some of the stuff I've seen on your Instagram is a lot of traction-based movements, so they hold on to a pull-up bar or like what is that? So what are you trying to achieve with
mhm.
that?
Yeah, so there's 3 main pillars of scoliotherapy. It's elongation, breathing, and then stabilization.
Okay.
So the traction element, that is the elongation element. So if you imagine a slinky and you're holding on to this analogy doesn't work for my young clients are like, "What's a slinky?"
Oh my god,
I'm like,
that's
"What?"
crazy. You're like, "Wait, you haven't heard of a slinky?"
Yeah, yeah. I always have to like kind of
Wow.
be like, "You've heard of a slinky, right?"
Yeah, I guess before there were iPads, our parents were probably like, "Hey, use this slinky on the stairs. We'll
Oh my
entertain you
gosh.
for a few hours."
Yeah, it's pretty fun. I always loved a slinky.
Oh my god, yeah, that's crazy. I didn't even think that they wouldn't know what that is.
Yeah. But if you know what a slinky is and you
Yeah.
hold 2 ends of a coil and you
Mhm.
provide an element of tension through both ends of a coil, you'll notice
Mhm.
that coil lengthens and gets straighter. And that's pretty much
Mm.
the whole idea with the elongation aspect. Now, I don't advise inversion tables because that's a passive traction on the spine, and you
Mm.
can get something called rebound effect if you do that. We do a lot of active traction. So you're getting some muscle activation and involvement while you're lengthening and elongating that spine. And generally, you can do that without having that rebound effect, which is like your muscles tightening up even more than they were beforehand. So that's
Yeah, I've actually had that. I don't have scoliosis, but I've had that happen after I've had traction on my back, and then it let goes, and I'm like, "Oh, whole back in spasm.
yeah,
Does not feel good."
no,
So, okay,
terrible.
so they would act what does active traction mean?
For instance, we have clients hang onto a pull up bar and let their feet dangle. But we're not just
Okay.
hanging off of the ligaments of our shoulders while you're in that
Yeah.
position. You're activating through that shoulder girdle to engage your back muscles so that you have some form of support as you're going through that elongation.
So engaging like your lats like you would if you are about to do a pull-up.
Exactly.
Okay, cool.
Yep.
Gotcha. That makes sense. Okay,
Yeah.
cool. Can Okay, so I'm sure people might be thinking like, okay, does this reverse the curve or does it keep it from getting worse?
Generally, up until the point you're done growing, you have the ability to reverse the curve. So that's when,
Oh.
you still haven't had your growth plates close. So they look at your your pelvis, and they see like the shadowing and can gauge how much of an ability you have to make a change in your
Mhm.
scoliosis. And then from that point, from adolescence on, our main goal with the Schroth therapy, scoliosis therapy, is to stabilize that curve so it's not getting any worse. So there is a very slight chance that you can reverse the curve a little bit in adulthood. I've had clients who have reversed or seen improvement like about 5 degrees.
Yeah.
Yeah, there's a little bit of room for error there in measurement.
Oh,
But
for sure. Yeah,
yeah,
that's hard. You'd probably have to get what, like a standing X-ray for like true. Would
yes.
that be, is that the standard of
Mhm.
care, like a standing X-ray? Yeah. And we're talking about this for people that have, does this apply? Because I have two brothers with muscular dystrophy and
Mhm.
they both had to have fusions because intrinsically they can't build up that muscle. So this is obviously for people that don't have
A nerve.
something like that. They're just able-bodied, but
Yeah,
don't necessarily they have a curvature in their spine, so they have scoliosis.
yeah.
Okay.
Generally, yeah, with the neuromuscular and that form, that generally can't really make a whole lot of change.
Yeah, that's why they went ahead and did their spinal fusion. My little brother Mikey had his, so he is
Mhm.
26, so he had his about 2 years ago, and it's funny because now when he sits in his wheelchair, he's so much taller. Like, we were like, "Dude, we had no idea how tall you were because he's completely disabled, he's in a wheelchair, but yeah, he went from slouching to then fully upright. I
Uh,
joke people always ask my brothers are like, "Wow, your posture's great." I'm like, "Dude, threats."
he's
But
got
it
no
saved
choice.
in their case, yeah, in their case, their surgery saved their lives
Right.
because
Mhm.
of he was getting compression of different organs and things like that.
Yeah.
While on the other hand, like the people we're talking about, there's a lot that people can do. They just don't know yet. And that's why I wanted to chat with you because I just find this whole side of physical therapy really fascinating and super helpful. And so there's a lot of these little pockets in healthcare that people aren't aware of, but we don't have the budget like surgical centers do to promote these things.
Yeah.
And yeah, so
Yeah.
that's why I'm like, let's talk about these things. But okay, obviously, so we're talking back about Tasha and her fear of getting pregnant. And
Mhm.
so before jumping into pregnancy, obviously before pregnancy, unless there's IVF involved, penetrative sex is involved typically, or IUI. But if we're talking about sex, are there certain positions? So let's talk about sexual positions with scoliosis.
Mhm.
So, are there certain positions that maybe they should avoid for a time being, or are there certain ones that you recommend? And I am sure that probably nobody's had this conversation with them. And so I wanted to ask you and see what you think on that.
Yeah, yeah. Positions that I generally recommend avoiding would be anything that would be like extension bias. So that would be probably doggy style. I don't know the names of all of the
It's
positions.
funny because, like, I try to describe sexual positions in a medical way, and I'm like, quadruped with penetration from behind. It's just doggy style, whatever.
Yeah.
Okay, so that would also, yeah, I don't know the names either.
Yeah.
I don't think maybe the Kama Sutra knows all the names. I
I
don't.
don't.
So, well, I'm assuming then maybe the person being penetrated face down and then
Yeah.
the person on top of them probably may aggravate it. What are some other extension-based positions? And I wanna just hear how you articulate these
Feel like my face
positions.
is getting red.
The Sex and Wellness
Um,
podcast, we gotta talk about sex.
yeah, so definitely those 2 really come to mind, and those would be the
Why is
biggest.
that?
Huh?
Why is that? Why should they avoid those positions or be careful in those positions?
I would just so usually extension can be irritating to scoliosis. It can also aggravate your back if you have a spondylolisthesis. A lot of people have those with scoliosis with the transition zones. They could just, if you have baseline pain, it probably isn't going to help anything. I don't know that
Well,
it'll necessarily decrease the amount of pleasure that you're having other than like your back hurting. in those
So
positions.
you find that because there are certain things like in the physical therapy realm, it's just there's a lot of fear-based stuff out there.
Yeah.
And so what you're saying is basically what can we do to empower them, but also at the same time is it they have to be careful in these positions or they just should not do them or
They
how they
can try it
feel?
out, but if you're having, like, baseline pain from your scoliosis, I'm going to guess that those will provoke your pain even more, those positions.
Okay. So basically be cautious in those positions, but
Yeah.
generally speaking, it tends to flare up more your clients. Is that what you're saying?
Yeah. Yeah.
Can they ever get back into those positions? Say they did a bunch of physical therapy and they've done stuff that you've told them to do. Is that a position they could try
Yeah.
again, or what is
I would say quadruped would be one to try before the
so
prone on the
let's
bed.
let's translate those into lay terms. That's doggy style and face down, butt up. I don't know the names. But
Yeah.
yeah. What's that?
Yeah, I would say if you do wanna try the one that's face down, possibly putting a
Mhm.
pillow underneath of your hips would
Perfect.
be
Okay.
beneficial. Also, like, if you have pelvic pain, I tend to see that people respond to that a little bit better, just
Just
flexing.
not in the okay, cool.
Yeah.
All right. And so what are some things that she can do to prepare for pregnancy? Just some common stuff that you see that's helpful.
The things that we were talking about with the scolio assessments and stuff. So, learning as much as you can about your curve type and your tendencies
Mm.
before you even get pregnant. Which way do you tend to shift your weight when you're in standing, when you're in sitting? What are better positions for you to be sleeping in that could just give you a little bit of passive help throughout the night? If you have a primary curve on your right thoracic spine and yeah, right thoracic spine. Laying
Mhm.
on your left side at night tends to be a little bit more beneficial than laying on the right side because
Mhm.
when you're laying on that left side, gravity's kind of helping you over the course of the night come into more of a neutral position, more of a relaxed state. Versus when you're laying on your right side, your curve is already dipping down into the mattress,
Mhm.
and gravity over the course of the night is pulling that prominence further into the mattress or further into your curve. So,
It's
understanding those things before you are adding such a big change to your body is key.
yeah, that sounds super important. If you're a sleeper like me, like you fall asleep on one side
Yeah.
and you wake up in crazy positions.
Mhm.
So doing the it sounds like doing the best that you can with kind of
Yeah.
keeping an eye on that and just bringing awareness to it.
Mhm.
And okay, and so some of those things. So where can they figure out what type of curve they have, which one's primary and
Mhm.
degree and all that stuff? Who would they go to for that? Because I feel like sometimes people just have no idea where to go.
Yeah. So, again, if you go to a general orthopedic doctor, they may be able to give you some of that information. Like if you get an x-ray done, they can review it. We could ask them to review it with you. If they have taken measurements for you, that helps. Even if
Mhm.
like they can't explain it to you, you can interpret it a little bit on your own. But if you don't wanna, like, play that guessing game because you've played that your entire life, finding, again, a specialist that can help you decipher and translate those images, I would recommend that. So, again, finding, like, a Schroth therapist, somebody that specializes in Pilates for scoliosis,
Mhm.
things like that. So
Gotcha.
mhm,
Okay, so you're saying if your curve, which way does the convex, so the convex is the side that kind of,
push it.
if, yeah, it pushes out. So it would look like the end of like the top of a balloon or something, like
Mhm,
more rounded
yep,
that way. And so if that side is faced to the left in the thoracic spine, you're saying that they would want to keep an eye on. So say we'll just say that's their curve, right? So it
okay.
like points to the left side.
Mhm,
In that case, what are some things that you said laying on their left side would be helpful? Is that what you're saying?
If it's pointing to the left, they would wanna lay on the right side. So, yeah.
So if they're pointed to the left, they'll wanna lay on the right side.
Mhm.
And then what are some feet positions that they should keep an eye on?
Feet positions.
Like feet positions, so where their feet like, where the weight is in their feet, right?
Oh,
If
okay.
they shift their weight to the right or left, you had mentioned that
Got it.
earlier. Not
I'm thinking of, like, sleep position and then your foot position when you're sleeping. I'm like, "You can do
I'm
whatever."
sorry. Sorry, I switched. I jumped to standing.
Yeah,
Uh,
that is something that I just talked about in my podcast, I think, a couple weeks ago is hip glide stuff. So
okay.
that can show you what your tendencies are with the way that you're carrying your weight. So
Mhm,
a lot of people, they have one hip that kind of pushes off to the side or
mhm,
translates off to the side, and it looks like a little shelf. So
mhm.
whenever you notice that on yourself, the way that you're holding your weight is usually on that opposite side.
Okay, so if their weight is, like, shifted, if their hip is shifted out on the right, they're probably putting more weight on the left, so they need to almost glide themselves back and put more focus on
Mhm,
that leg.
mhm,
Yeah, I find that even in people without scoliosis, I find that kind of even just bringing that body awareness to people is huge because
mhm.
there's nowhere in at least US education where people are taught about their bodies in
Yeah.
this way. Some people are really intuitive with it. I find sometimes if people have played sports as a child, they're a little bit more intuitive. But other than that, it's still, and I've still seen people that have played sports and that
Right.
aren't that intuitive. And I've even felt that myself. I had my neck, I just woke up one day, I had a ton of neck pain, couldn't move my left arm, and I was, like, getting all these surgical consults just in case. Obviously, I was doing PT, ended up being fine, but what happened is, like, the proprioception, so where my neck was in space, so I couldn't feel, like, where my neck was, so I needed that kind of mirror. I need someone to cue me to feel it, and I'm like, "Wait, I'm a physical therapist. I should know this." But
Yeah.
when you have pain, it kinda inhibits that proprioception, and for
Mhm,
people that don't know what proprioception is, it's your body's awareness in space. So if I close my eyes and hold my hand up, I can still keep my eyes closed and know where my hand is, versus if you have an injury or impaired activation of the nerves to those areas or impaired proprioception, you can't feel where your arm is in
mhm,
space. And so that I think that's great because you're teaching them, hey, kind of keep an eye on how you're standing and you can make these little adjustments throughout the day.
mhm.
I also feel like there's this fine line between obsessing about it and getting anxiety about it, and then just giving yourself the patience that this is a process and you are learning your body. It's a skill,
Mhm.
and that skill takes time, repetition, and practice. Would you
Yeah.
agree, or what do you
Oh,
often see?
yeah, yeah. I always tell my patients when they're getting frustrated,
Y-
"You've been holding yourself,
Yeah.
you've been living in your curve your entire life, like, whether
Mhm.
that's 30 years, 60 years, 70 years,
Mhm.
and you're now coming and getting some help for it. You're not going to be able to just snap your fingers and have an understanding. Your brain needs to play some catch up with it. Like, you
Yeah.
have to be patient with yourself." And I usually tell them with my program, I do like a 6-month long small group coaching program.
Mhm.
And every week we focus on a different element of the scoliosis therapy. So like week 1, we're
Mhm.
just focusing on elongating that spine. Nothing else.
Mhm.
Don't try and
Yeah.
organize all the different elements. Just try and
Mm.
elongate any time that you think about it. And then the next
Mhm.
week we add on another layer, and then the next week we add on
Mhm.
another layer. So the person doesn't become so overwhelmed by having to think about 80 things all throughout the day. It just becomes more second nature to them over time.
Yeah, I mean, there's 3 phases of learning, right? There's initial where you have to use 100% of your brain, all of your senses, and you're just so focused, right? And then it shifts to kind of 50-50, 50% second nature, 50% focus. And then, like you're saying, it drops into that next bucket of kind of second nature. And just like any sport. Like, I just picked up tennis. I get frustrated that I'm not a pro. I just started last March and I took 6 months off. Like, who am I?
You're making good
But I
progress.
yeah, okay, why am I not playing in the US Open? And that's weird. But the point is we have to remind ourselves, hey, the brain can only comprehend so much at a
Mhm.
time. And so taking these bite-size movements are really just patience and time and really committing to that this is a process,
Mhm.
right? And it's a journey, it's not a destination. And so if it was a destination, none of us would, yeah, I don't know, grow
Yeah.
in general as anything.
Yeah, you just
And
get fresh.
so, yeah, exactly. You just get angry and stay
Give
in this
up.
negative mindset. And yeah, yeah, exactly. So, what are some things? So, we talked a little bit about too, like you said, okay, so just reviewing what we just chatted about. Okay, so number one, before pregnancy, getting assessed by hopefully a Schroth physical therapist or physical therapist that specializes in scoliosis. And if sometimes people don't necessarily have access to that, you have a 6-month program which people can have access to
Mhm.
as well. The other thing that people can do is potentially see their doctor that may or may not give them that information. And so they can figure out A, what type of curve they have, and then from there, and their height, and then their hip glide, so how they're standing. And so then they have a good baseline. So then the next step would be obviously like we were saying, those things that we just talked about, like seeing those physical therapists who
Mhm.
specializes in it. And then on top of that, then adding strength training.
Yeah.
So we talked about a lot of unilateral. So one-sided strength training. Overall strength training is great, but if you, like you're saying, if there's this imbalance from one side to another, focusing on some of those movements that you would replicate having a child.
Yeah.
So all those different movements.
Mhm.
So what would you say? So what are some things that you feel that she needs to think about during the pregnancy or to prepare for birth? Because I feel like there's these different phases, right?
Mhm.
Just even thinking about pregnancy, actually being pregnant, birth, and
Mhm.
then postpartum and caring. So we've got pre-birth. So now what, like during pregnancy, should she think about?
And so during pregnancy, a lot of the things that we already talked about, because you'll have that addition of the weight that you're carrying with the baby. And then understanding where your curve is. So, like where your main curve is. So, if you have more of a lumbar curve, which is
Hmm.
in the lower back, you really want to be focusing on stabilizing as much as possible because your lumbar spine is inherently more flexible, meaning it can be a little bit more loosey goosey on you when you're carrying your baby in
Hmm.
pregnancy. And then,
And that's because just interjecting here for people
yeah.
to visualize why. So the thoracic spine is it's pretty stiff compared to the neck and the low back. And that's because it protects our vital organs. It protects our lungs, it protects our heart, right? And we need a little bit more stability along that area. And so the thoracic spine has more rotation than it does flexion and extension. And so sometimes when you have stiffness or that in your, that's why you have more mobility in your low back and neck.
Mhm.
Anyways, keep going.
Oh, that's good. No. And then if you have like more of a main thoracic curve, you want to be focusing more on your breathing, your vital capacity, your lung
Cool.
capacity, because it tends to be more compromised in people that have a thoracic curve. On that side where you have the concavity, where it's that C shape, it's the side that's closing
Yeah.
down and it's hollow. That side tends to squish your lung
Yeah.
on that side. Working on getting that expansion, during pregnancy, before pregnancy, even that's kind of more of a priority for you. And your vital capacity will decrease with pregnancy anyway. So, you talk to um, women who are pregnant and they're going up and down their stairs and they're like, oh my gosh, that's
Yeah.
getting really hard. And it's because, your belly's kind of pressing up on the diaphragm and on the lungs. And
Yeah.
so it just kind of
Well,
amplifies
what I found pretty
things.
cool too is just even thinking about, okay, so say they have that C curve, do you ever like kind of lay them in the opposite direction, have them breathe into like that side of that thoracic spine? I think when we think of breath, we don't think of it as, we just think of it as, oh, breathing, but it's like, wait, we have lungs in
Yeah.
different parts of the lungs. And so we can actually get oxygen to those lower parts and kind of get more mobility in those ribs to help with that lung expansion. And so that's something that you typically know.
Yeah, so there's a lot of different ways that we do it, but that's another element of the Schroth therapy is the breathing aspect. So, um, your ability to expand your lungs can actually change the shape of your rib cage. So, getting that lung expansion, it acts as like a little person inside your rib cage, punching out those hollow spaces, and you can actually change, the actual visual shape of your rib cage through learning how to breathe in a
It's
specific way. So
freaking
it's pretty
incredible.
sweet. It's
It's so
so cool.
mind-blowing. Like these discussions I have with practitioners like yourself, it's just like, man, I just need the whole world to know this. And so, okay, so we've talked
Yeah.
about, so the one thing we didn't talk about, or we talked about like some things to prepare for postpartum, but what about birth? What are some big things that they can do to prepare for in birth or giving birth?
Yeah, so it's not terribly different from, somebody that is without
Mhm.
scoliosis. Again, I think learning and understanding your options for birth positions is super duper important. Especially, once you have an understanding of your curve type, being again in that like side lying position on that
Mhm.
concave side is going to be more comfortable than, if you're laying on that primary side while you're giving
Yeah.
birth.
I think we haven't
Mhm.
talked about necessarily the different birthing positions on this podcast yet, but there are so many different birthing positions, like on all fours, laying on your side, leaning over a bar, on your knees, leaning on the back of the bed, all these different positions you can be in when, and then understanding like your breath, right? So, and how to slow and controlled exhale using your diaphragm versus holding your breath and pushing out through your belly. So that will be another podcast that we'll dive into with that, but I think it's good for people to know that, hey, there are these options for different birthing positions and generally mobility. I have a lot of people post getting ready for to give birth work on hip mobility. So a lot of like those 90-90 movements,
Uh,
because that's huge,
mhm,
and then practicing, like, their slow and controlled breath, and actually, I have them practice pushing down. I don't tell them practice pooping because that goes through the
mhm.
anus. I'll say, "Practice, like, pushing a tampon
Yeah.
out," and then if they have a partner, I'll
Mm.
say, "Push your partner out," like, just practice that. Usually the part Yeah, usually the
Oh,
partner's like,
interesting.
"Wait, what are
Yeah.
you doing?" And they're like, "This crazy physical therapist told me to do this." But it kinda aims it, right? Because 'Cause we're so used to pooping out
Yeah.
the backside of the pelvic floor, so kind of
Mm.
pushing down, so people kind of connecting their brain to the pelvic floor because there's that huge disconnection because nobody's talked about it. And so
Yeah.
that can actually take some time too. I remember the first time before I was a pelvic floor physical therapist, I felt so disconnected to my pelvic floor. I didn't know how to activate it. And so sometimes I'll just have people lay down and look at their vulvas and then kind of pull up and then push down so they can see that. If
Mm.
you're doing a Kegel, is if nothing else is moving, but you can kind of see that little space in between the anus and vagina almost disappear because it's pulling up. And so you're gonna have to kind of spread
Mhm.
the labia and butt to be able to see it in the mirror. But by kind of seeing that
Yeah.
connection, can make a big difference. So you can kind of practice some of those movements. But anyways,
Yeah, that's huge, and that's also a disconnect for people that have scoliosis just because of muscle imbalances. It makes it extra hard to connect to any muscle in your body. So that
yeah.
includes the
Well, I
pelvic
mean,
floor.
it makes sense, right? Because, the spine is where everything comes out of, right? So our brain then tells our spinal cord, which then sends the peripheral nerves, with the nerves that are not on the spine, out to our arms and legs. And so I could see how that might take more time for somebody with scoliosis to really be able to process and connect more with their bodies. But overall, it's really kind of this underlying theme that you're saying is just like understanding your baseline and then understanding your body because it might take somebody with scoliosis a little bit longer than somebody that doesn't have it. And that doesn't mean there's anything wrong with you. It just means that, hey, this is a different journey. You have a different journey than somebody else. And that's just, but there's all these resources out there as well. So, well, thank you so much for being on here and just kind of recapping
Yeah.
here talking about your program. So I would say, how can they reach you? So they can follow your Instagram and then reach out to you if they're interested in your 6-month program?
Yeah, that's probably the easiest way. I also do
Yeah.
have a podcast as well where there's lots of free information. It's
Ahead of the
called Ahead
curve.
of the
Okay.
Curve. So I'm on all of the major podcast platforms. And yeah, if you're interested in working together, we usually start off by doing a little discovery call to make sure it's a good fit for the both of us. If it's not a good fit, my goal is always to kind of help people navigate and find something that is a good fit for them so that they can get some
Perfect. And
help.
then just to kind of reemphasize,
Yep.
your Instagram is the scolio therapist.
The scolo
I said
the
the scoliosis
scoliotherapist,
therapist at the
yes.
beginning, but what I'll do is I'll tag this in the show notes for your podcast and your Instagram handle. So, alrighty, well, we will
Alright,
chat
sure.
soon. Thank you.